Hi, my name is Doug Macallum. I'm a physical therapist here at BYoung Physical Therapy in Raleigh, and we have a very exciting day. It's Carter's first day of physical therapy. He has 1 week post-op UCL reconstruction, and it's a very important day to get started on his rehab. He's going to come in with a posterior splint. It's pretty much just a cast that holds his elbow at 90 degrees. We get to take that off, and I had Tyler, our DPT student from Duke University, help out with that process. Once the posterior splint is off, we're going to do some range of motion. Range of motion is as tolerable at this time, and that just means that we get to go until he tells us to stop. It's going to be a little sore and uncomfortable, but that's part of the process, and it will improve as long as we just do it in a progressive manner. We're going to take some measurements and see what he's doing on day one, and then we're just going to progress all the way down to full range of motion of extension, flexion, pronation, supination, radial deviation, and ulnar deviation. As a shoulder and elbow specialty clinic, we see these UCL reconstructions all the time, and it's one of my favorite things to treat. The day one is super exciting because they finally get out of the cast and into the brace. It's a sense of freedom, and it really marks the beginning of the rehab journey. Rehab starts today, and we're going to take him through all the range of motion protocols that he needs to hit, all the strength training that he needs to do, all the pre-throwing exercises. Then we're going to implement a throwing program. Once the throwing program is done, since he's a pitcher, we're going to start doing bullpens. Throughout the whole process, we're going to look at his throwing mechanics. We're going to use all of our high technology to make sure that his arm is stable and powerful and right where it needs to be for healthy throwing. Once he is cleared to throw, we're going to start throwing, and we're going to look at his mechanics throughout the whole time to make sure that they're healthy and efficient, make sure that we're not overloading the elbow and or shoulder while he's going through our program. One of the great things at our clinic is we have the space to do all the rehab throwing in-house. We have radar guns to progressively track velocity, and we have TrackMan data once he is done with the bullpen program to actually work on pitch design. Now, resistance training, power training, throwing, and pitch design might seem far away, but we're going to take it one day at a time, make sure that we're doing everything correctly, make sure his elbow's feeling really good each step of the way. We're going to get him back on the field in no time.